Today we're talking about Zonisamide, a seizure medication that's becoming more and more common for dogs with epilepsy. We'll go over how it works, the benefits, and possible side effects. If you're watching this, chances are your dog has been diagnosed with epilepsy and you're looking for helpful information. First of all, I want to say you're not alone. Managing seizures can feel overwhelming, but there are medications out there that can help your dog. Before we get started, I want to remind you that I'm not a veterinarian and this is not medical advice. My name is Mandy and I'm just a fellow pet owner sharing what I've learned through my own experience of owning a dog with epilepsy for almost 8 years. Zonisamide is one of the medications that Ruby takes, but always talk to your vet about questions you have regarding your dog's health and medication. So what is Zonisamide? It's an anti-seizure medication that's used to help control epilepsy in both humans and dogs. That's right, this is another medication that's also prescribed for people with epilepsy. Because of that, you can get it from a regular pharmacy instead of just through your vet. This can sometimes save you money, especially if you use any of the discount programs like GoodRx by checking different pharmacies for the best price. If you haven't checked out GoodRx yet for your dog's seizure meds, I would highly recommend it. I use it and it has saved me thousands on the 3 epilepsy medications that Ruby takes. It's free and simple to use. So, how does Zonisamide help control seizures? Seizures happen when there's too much electrical activity in the brain, almost like a lightning storm. Zonisamide works by calming down that activity in a few different ways. It helps block certain brain signals that can trigger seizures. It affects the way sodium and calcium move in and out of brain cells, making it harder for seizures to start. It also has some mild anti-inflammatory effects in the brain, which may reduce seizure activity. The great thing about Zonisamide is that it works in multiple ways, making it a solid option for dogs who need seizure control. Some dogs take it alone, while other dogs take it along with other seizure medications like phenobarbital or levetiracetam, otherwise known by its brand name Keppra. My dog takes all 3, and Zonisamide was the 3rd medication added after a particularly bad time with seizures. So many vets like to prescribe Zonisamide because it's effective for many dogs. It usually has fewer side effects than some other seizure medications. It doesn't require as many blood tests like phenobarbital does. It's not as hard on the liver, making it a good choice for dogs with liver concerns. It can be more affordable than some other medications, especially if you get it at a pharmacy with a discount program. So, of course, like any medication, Zonisamide does come with some possible side effects. The most common ones include sleepiness or drowsiness, especially when first starting the medication, loss of appetite. Some dogs may eat less at first, wobbliness or unsteady walking. This usually improves as your dog adjusts to the new med. Mild stomach upset like vomiting or diarrhea, though, that isn't very common. Most of those side effects go away after your dog gets used to the medication. However, in rare cases, Zonisamide can affect the kidneys, so your vet may still recommend occasional blood work to check that. I think Ruby had blood work done once by a neurologist in the almost 4 years of taking Zonisamide with no issues. Seizures can be scary, but the good news is that there are effective medications out there, like Zonisamide, that can help your dog live a happy, healthy life. Whether your vet is starting your dog on this medication or you're just looking to learn more, I hope this video helped break things down in a simple way. If you found this video helpful, please give it a thumbs up and subscribe for more tips on managing dogs with epilepsy. This also helps YouTube push out the video to others who may be searching for more information regarding their dog with epilepsy. Thanks for learning with me as I learn with Ruby.